To all the new nurses or all the ED nurses that want to excel their careers in an emergency department, we got Justin Palacio here, who has been an ED charge nurse for about 2 years now in one of the busiest trauma centers here in California, United States. So we're gonna ask him the most frequently asked questions. So let's get started.
Hello. My name is Justin. I'm one of the charge nurses here at the San Joaquin General Hospital. Here we're a level 2 trauma hospital. Just like every other emergency department, we have our ups, we have our downs. Being a trauma center, we do have a lot of high acuity patients coming through here.
So Justin, first question, what are the biggest challenges you face as a charge nurse in the ER?
One of the biggest challenges that we do face is patient volume and acuity. Especially around the time, when flu and everything comes by, the acuity levels do tend to shoot through the roof, as well as rainy seasons, we see all those trauma patients that come through. Other difficulty we face is staffing and resources. Making sure we have enough staff to cover the volume of patients coming through the ED can be a challenge in itself. But working along a great team does help with that, and ensuring that we have trust communication among everybody. Any conflicts that do occur, we're able to resolve those in a timely manner, and just ensuring patient care is carried out. And obviously the big one that we face down here is burnout and emotional strain. As every department, especially the emergency department, we do see a lot of people that get burnt out. These long 12-hour shifts that can take its toll on you. Just making sure, one thing that does really help is ensuring that teamwork, collaboration, working together, when they come through and work together, everything seems to run a lot smoother.
All right, Justin, second question. How do you manage patient assignments and prioritize critical cases?
One of the big ones is going to be definitely using our triage system. Every nurse that we try with comes through the ED, we train to utilize and understand our triage system, so this way we can determine the patient's level of acuity. Based on that level of acuity, we can give them the proper care needed. Being a trauma center, if we do need to activate them as trauma, we're doing so in accordingly and in a timely manner, as well as strokes or any other cases that may come through.
All right, Justin, thanks for your answers. Now we're going to go to the third question. How do you support your team during high acuity situations or a full department?
One thing that really does help support a team is obviously just being a leader with that can lead with calmness and confidence. Your team's looking up to you, so just making sure you're maintaining that confidence can really amplify the people around you to feel a little bit more confident, and just prioritizing and delegating effectively. We do use the nursing ratio here in California, 4 patients to 1 nurse. And with that in mind, I always tell my nurses, hey, if you're not struggling, if you're pretty caught up on things, look to the nurse to your left and look to the nurse to the right. If they're struggling with anything, try to help them out, because we're all part of the team at the end of the day, and we're all trying to get a job done.
Well, that's a great answer. All right, one last question for you. What advice would you give to a new nurse starting in the ER?
Focus, just one of the biggest things, just focus on the basics. You're not going to learn everything in one day, but just getting back to your roots. You learn a lot in nursing school, and just building a great foundation is what's going to really help develop those nursing skills needed to utilize them in the emergency room, as well as prioritizing and learning that triage system that we mentioned earlier. And definitely always ask questions. Don't be afraid to ask questions. Find a great mentor. You probably have a few mentors going through. Find one that you can really connect to, and find one on the floor that's kind of working the same schedules that you can always fall back and in onto if you have any questions. Again, always ask questions, and don't be afraid to stop learning. Another thing is just ER is going to be chaos, so just learn to embrace it, learn to be flexible, and learn adaptability, and most importantly, learn self-care. Take care of yourself, otherwise you're not going to be able to take care of your patients.
Well, thank you so much for your time, Justin, and keep doing what you are. You're an amazing charge nurse. Thanks.
Thank you.